Hey guys, Dr. Angelina again with Surgical Arts and IBI Healthcare Institute, and I'm doing a series of videos at the beginning of the year to just answer some of the very basic questions that are common. One of the questions I've been seeing, quite basic to me because I guess I've been doing it long enough, but I realized for some patients, certain details are just not clear. So the question I saw was, can the surgeon cancel your surgery if you have high blood pressure? Legally, surgeon can cancel any operation he or she likes if they feel the patient's safety is compromised. Legally, it's our obligation to do what's safe for the patient. It is our obligation to do no harm. If we get to the day of surgery, let's say after we did extensive workup and all the clearances, which hopefully your surgeon does to evaluate what's good for you and if you're ready for surgery, and you come in day of surgery and something happens and your blood pressure is going through the roof, that day it's going to be absolutely up to your surgeon and anesthesiologist to decide whether they feel safe to put you under. So blood pressure is a very common problem in America, is severely underdiagnosed. They do call it silent killer because a lot of people don't know they have high blood pressure. Also, a lot of people may have a stage 1 hypertension, which means the blood pressure is higher than normal, but it's not too high to trigger emergency room visit or doctor visit. But people live in that kind of, they survive and that slightly higher blood pressure than normal. So instead of normal 120/80 blood pressure, some people will be living their life with blood pressure of 130/90. They never go to the doctor to check on it. They might not have any symptoms, but underlying problem is still happening. So that could trigger, let's say when you're nervous, your blood pressure goes really high. And you're like, I never have problem, not on any medicine, I'm not seeing a doctor. Just because you're not seeing a doctor for your blood pressure doesn't mean you don't have a problem. What can happen on the table though, you're under anesthesia, especially if it's a big surgery, your heart is trying to run a marathon, your body is going through a lot of stress. So last thing I want is for my patient to have a heart attack because we're doing cosmetic surgery. So it is very important to notify a doctor about any potential medical problem. If you had previous problem with anesthesia, if you had previous problem with heart, you had previous cardiomyopathy, heart failure, even though it's fully recovered, or you've been on previous blood pressure medicine, but now you're off of them because you're doing better, you lost weight. A lot of people will improve their blood pressure by losing weight. That needs to be communicated to your doctor ahead of time. So appropriate workup is done, that you're in appropriate facility for surgery. But even again, during the day of the surgery, if your blood pressure is so high that cannot be controlled by anesthesia provider or nurses, usually they can administer medications to make things better. If we feel like we can control it, we can proceed with surgery if it's safe. But if we can't, the surgery can get canceled. And it's not something we're going to joke about. It's not something we're going to take lightly because it is your life. Same goes for high sugar. So if somebody's diabetic, normally we try to avoid doing true cosmetic surgery, large incisions on somebody who's diabetic, especially uncontrolled diabetic. We want to get those numbers better and fully controlled so you get better healing and you don't get infection after surgery. But if your sugar's through the roof, we can cancel surgery. Because cosmetic surgery especially, it's not an emergency. It can always be canceled. I don't care where you're flying from. I don't care what excuse we have, who took time off. If your safety is compromised, surgery will be canceled. Another issue is eating the night before surgery. If I'm putting you to sleep, you have to have empty stomach for 12 hours or 6 to 8 hours prior. I usually say 12 just to make sure. If your stomach is full of food, when the tube goes in and you're asleep, you cannot control your vomiting, your reflux. You cannot control what's coming out. So you can easily aspirate that food and it can go in the wrong throat, meaning in your breathing pipe, and choke you and cause pneumonia or worse. If you ate the night before, didn't tell us, you're literally putting yourself at risk of dying. What other things can happen? Smoking. I check all my patients for smoking ahead of time. And if you were negative at pre-op and then you are positive the day of surgery, I may cancel your surgery because your healing will be compromised. You can get wound necrosis, the incision can open up, you can get infection. Just having an uglier scar is no reason to do surgery on a smoker, a heavy smoker with a long incision, and then worry about wound healing. Or flap survival. So flap is when we separate piece of skin and fat away from the muscle and underlying tissues, and then we'll kind of pull it back and try to make it heal again. If your healing is not optimal, you can get a hole in your face or something. Like, why? So we use common sense. Safety is always a priority. Legally and ethically, it is our job to cancel cases in those patients who are compromised. Now, one more caveat. The patient who wrote the question, she was saying that normally she's completely fine. It's just that the doctor, she gets nervous. If you know your doctor, if you know your surgeon, they'll know that about you. They have done previous workups to show that your heart is good, and they'll know the blood pressure will come down during surgery when they give you special medications, and they shouldn't cancel your surgery for that. But if they don't know you, they've never had the proper workup, then it's up to them to do what's best and safest. So good luck with that. Make sure to ask all those questions and bring all those issues up to your surgeon at your pre-op appointment. Good luck.